Hello, everybody. My name is Lindsay Burkholz. My partner Allison and I did our needs assessment on the trauma treatment for foster children. I completed section 2 of the paper, so that's what I'm going to be talking about today. Allison will be talking about section 1 and 3 in her video. So let's get started. Made clear by the key informant interview and other findings, it is clear that in the state of Wisconsin, there is an issue regarding the treatment of trauma in foster children. While there are many reasons for foster children to experience trauma, it is a very relevant problem that needs to be addressed. As mentioned by the interviewee, Wisconsin traditionally neglected the treatment of trauma in foster care and has since been making some efforts to combat this issue, such as automatic badger care for foster children, as well as funds to the foster parents to support the children. Even though this helps the children somewhat in these foster homes, it is not totally working, as foster parents receive a check and are able to use that money for whatever they see fit. According to the interview, some children never even see the money set aside for them in foster care. This is so important to note because there are so many children in foster homes suffering from numerous traumatic experiences, and sometimes the money allotted for them and their health and success are not always used to better their lives. Children in our foster care system deserve better, and it is clear that something needs to be done about this issue. It is imperative that the state of Wisconsin implements a program or applies an intervention to provide assistance to children in the foster care system who experience some type of trauma, whether that be from their previous home, their foster home, or anything in between. Sometimes, even though efforts may have already been made to improve an issue, there can be more done. In this case, introducing an intervention to help solve the issue of untreated trauma in foster children is necessary. The intervention chosen to solve this issue is a 3-part treatment program by the name of System of Care. The 3 treatment options are child-parent psychotherapy for ages 0 through 6, trauma-focused cognitive behavioral therapy for ages 6 through 12, and structured psychotherapy for adolescents responding to chronic stress for ages 12 through 17. This would hopefully be the backbone for a unique program made just for the foster children of Wisconsin. Basically, there are 3 different treatment types for 3 different age groups, because different age children process trauma in different ways. Child-parent psychotherapy allows for children and parents to develop a stronger bond within their relationship while trying to resolve any traumatic feelings at a young age. Additionally, trauma-focused cognitive behavioral therapy is best for a school-age child who has experienced discrete trauma. Finally, structured psychotherapy for adolescents responding to chronic stress is a treatment designed for teenagers who have been exposed to severely traumatic experiences such as community violence or life-threatening illness. According to the research, after studying a diverse array of foster children and their trauma levels and behaviors after receiving treatment from this program, the System of Care program, specifically the 3 different treatments within the program, was beneficial at treating traumatic symptoms across race and age demographics. This study was done in Illinois, which is close by. Because of this, it would make it easier to transition into a successful program like this with ease. While implementing this program may seem like common sense to most, there can be some obstacles that social workers face when trying to implement these treatment options. For example, lawmakers and policymakers can be an opponent in this way. Sometimes there may not be enough funds, or even lawmakers may not think that it is as important as those fighting for social justice do. It is the job of social workers to advocate for change and do what is right to help the foster children of Wisconsin. As mentioned previously, lawmakers may prove to be an obstacle when it comes to implementing a program such as this one. One way to combat this obstacle is to use personal findings or stories to help the case for funding or necessity. Research shows that providing personal experiences when trying to persuade lawmakers and policymakers toward a specific route helps with the case. According to Mosley and Gibson, types of evidence from empirical findings to personal anecdotes were utilized by advocates during the 2 years leading to the passage of California's historic 2010 law to extend foster care. Because of this, it is clear that features such as personal stories when discussing a new treatment option with lawmakers can be key in getting them to see things from the perspective of the children who are in need. In conclusion, there is a clear need for reform in Wisconsin regarding the treatment of traumatic symptoms in children in the foster care system. One way to combat this issue is to implement a unique program similar to Illinois' system of care, which includes different treatment options for different age groups in foster care. As mentioned previously, studies show that using a treatment plan such as this one improves traumatic symptoms across the board. Additionally, lawmakers and policymakers can become an obstacle when it comes to funding or trying to pass a bill in favor of the reform. To combat this obstacle, social workers should include solid evidence in favor of their stance, as well as personal stories during meetings or testimonies. This will help lawmakers understand the importance of the issue. Overall, a program designed like System of Care can help combat the issue of untreated trauma in foster children in Wisconsin. These are our resources, and thank you for listening.